Hello and welcome. Today we'll be delving into a specific and often overlooked manifestation of tuberculosis, ureteral tuberculosis. This disease, affecting the tubes that carry urine from your kidneys to your bladder, can have serious implications if left untreated. We'll explore its causes, how it affects the body, how it's diagnosed, and what can be done about it. Ureteral tuberculosis, as the name suggests, is caused by Mycobacterium tuberculosis, the same bacterium responsible for pulmonary TB. However, in ureteral TB, the primary infection is usually in the lungs or less commonly elsewhere in the body. The bacteria then travel through the bloodstream, a process called hematogenous spread, to the kidneys. From the kidneys, the infection descends down the urinary tract, ultimately affecting the ureters. Rarely, ureteral tuberculosis can be caused by direct spread from an adjacent organ infected with tuberculosis. The pathophysiology of ureteral TB is a gradual and destructive process. Once the bacteria reach the ureter, they begin to colonize and cause inflammation. This inflammation leads to the formation of granulomas, which are clusters of immune cells attempting to contain the infection. These granulomas can cause narrowing or strictures of the ureter. As the disease progresses, the ureteral wall becomes thickened and fibrotic, further obstructing the flow of urine. This obstruction can lead to hydronephrosis, which is a swelling of the kidney due to the backup of urine. In severe cases, it can lead to kidney damage and even kidney failure. Ureteral tuberculosis is relatively rare, even in regions where pulmonary TB is prevalent. It typically occurs in adults, particularly those with compromised immune systems, such as individuals with HIV, diabetes, or those undergoing immunosuppressive therapy. While precise global incidence figures are difficult to obtain due to underreporting and diagnostic challenges, its presence should always be considered in patients with a history of TB or those presenting with unexplained ureteral strictures, especially in TB endemic areas. The signs and symptoms of ureteral tuberculosis can be subtle and easily mistaken for other urinary tract conditions. Common symptoms include flank pain, which is pain in the side of the body between the ribs and hip, frequent urination, urgency to urinate, and dysuria, which is painful urination. Hematuria or blood in the urine may also be present. In some cases, patients may experience symptoms related to the underlying pulmonary TB infection, such as cough, fever, and weight loss. It's important to note that some individuals may be asymptomatic in the early stages of the disease. Diagnosing ureteral tuberculosis requires a combination of clinical suspicion and specialized tests. A thorough medical history, including any prior history of TB exposure, is crucial. Urine analysis may reveal the presence of white blood cells, red blood cells, and potentially even Mycobacterium tuberculosis. Imaging studies such as intravenous pyelogram, as IVP or CT urogram, are essential to visualize the ureters and identify any strictures, thickening, or hydronephrosis. The gold standard for diagnosis is obtaining a urine sample for culture and identification of Mycobacterium tuberculosis. In some cases, a ureteroscopy with biopsy may be necessary to confirm the diagnosis and rule out other conditions. Ureteral tuberculosis is not typically classified into distinct types, but rather staged based on the severity of the disease and the extent of ureteral involvement. Early-stage disease may present with minimal ureteral changes, while late-stage disease can involve extensive strictures, hydronephrosis, and potential kidney damage. The staging of the disease is important for guiding treatment decisions. The primary treatment for ureteral tuberculosis is anti-tubercular medication, following established guidelines for treating TB. This typically involves a combination of multiple antibiotics taken for a period of 6 to 9 months. In addition to medication, surgical intervention may be necessary to manage ureteral strictures or hydronephrosis. This can involve procedures such as ureteral stenting, ureteroplasty, a surgical repair of the ureter, or in severe cases, nephrectomy and removal of the kidney. Regular monitoring is crucial to assess treatment response and detect any complications. Preventing ureteral tuberculosis primarily involves preventing the initial TB infection. This includes measures such as vaccination with BCG vaccine, particularly in high-risk populations, early detection and treatment of pulmonary TB, and maintaining good hygiene practices to prevent the spread of infection. In individuals with known TB exposure, prophylactic treatment with isoniazid may be considered to prevent the development of active TB disease. The prognosis for ureteral tuberculosis is generally good with early diagnosis and appropriate treatment. However, delayed diagnosis or inadequate treatment can lead to significant kidney damage and long-term complications. Recent research has focused on improving diagnostic methods, such as the development of more rapid and sensitive tests for detecting Mycobacterium tuberculosis in urine. Additionally, research is ongoing to explore new anti-tubercular drugs and treatment strategies to improve outcomes and reduce the risk of drug resistance. Thank you for watching, and we hope you found this information helpful.